we're going to be taping now is one of the ligaments in the thumb that can commonly get injured. If your thumb gets taken out to the side, it gets flung backwards, okay? So one of the first things we like to do is you get what we call your traditional 38 millimeter length tape to create an anchor. So create that anchor, doesn't have to be too tight at all. Now, we rip the tape, but you can use scissors if you can't rip the tape, absolutely fine. We're then going to take our 2 centimeter length tape. Now, if you don't have 2 centimeter length, you can just rip down the middle of the 38 millimeter to make the same sort of tape. We've got the luxury of having some 2 centimeter tape, okay? So comfortable position with the hand, like you're holding a glass of beer, normally we would say, or a glass of water. Coming down from palm side, keeping it around the base of the thumb, because this is the joint that's injured. We're not trying to tape up in here with this tape, but keeping it nice and low. Make sure you're not going too tight, because we're going to be doing 3 consecutive, what I would call your breast cancer ribbon style signs. So coming down and placing it nicely. As you can see here, we're getting that ribbon type. We're now going to overlap that by 50%, just making sure our hand stays in that nice functional position. Coming around, again, you can see I'm not going too tight, always checking that the circulation in the fingers is still coming back. So we're not getting any change in color in blue or white. Definitely not blue. That would not be good. Now we're going to be doing a third one. Overlapping again by about that 50%, keeping our hand in that nice position. Okay, so you'll see through here, as we now have a look, you're going to have a nice neat line coming through, okay? After we've done this, what I like to do is these extra, what I call reinforcing strips. Get your 38 millimeter, rip it off, and on the ground. Rip it a little bit so we've now got like a spaghetti leg type strap. Now, whichever direction you feel most vulnerable in. Now, for most people, it's getting flung backwards is where they feel vulnerable. Place the tape on the opposite side. So we're just going to wrap again that neatly around through here, not too tight. Then holding on, you pull the tape in the opposite direction and down. So what you're finding now is you're going to have that support for going backwards. After we've done that, smooth it all down, then all you need to do with either your 2 or your 38 millimeter tape is just re-anchor those off, okay? Coming around, locking it off, and again, making sure we've got that good capillary return through the thumb.